What makes a person a good candidate for liposuction is that they have an appropriate amount of fat that is removed, that fat is well defined so we can really match that to the rest of the body. And one of the most important things is, what is their skin like? If somebody has loose skin, then liposuction may reduce that fatty bulge, but the skin may look worse, and we need to think about another solution. That's sometimes when we're talking about tummy tucks or a thigh lift or an arm lift. There's usually not a lot of scarring that goes on with liposuction. We can take some examples. So if you're having your tummy done, you may have 2 to 3 small incisions. Each of these are going to be 1/4 to 1/3 of an inch. They're hidden in your groin crease, sometimes in the belly button, so they're very inconspicuous. If you're doing the love handles or the back area, you might have 1 or 2 incisions at each of those sites. And if you're doing the inner thighs, for instance, we would put a tiny little incision in the groin crease. Again, it's not going to be very visible. So there are several different types of liposuction, and I think it's really important as a potential patient to kind of understand, because there's a lot of hype around a lot of this, and sometimes there's not that much difference. So the traditional liposuction we call SAL, suction assisted lipectomy, and that's where we use smooth tubes that have small holes at the end. They're connected to a vacuum, and as you place those through the fatty layers, the fat sucks into that tube and is removed from the body. That was created 40 years ago, and it still works really well, and it's still a part of what we do all the time. However, you hear a lot about kind of newer technologies: laser liposuction, water jet liposuction, ultrasonic liposuction. All of those can work, and what's really important to know is that the results aren't substantially different between those. What's important is that the surgeon knows how to use that technology in their hands. It works better. In some cases, it's much better to go to sleep to have liposuction, but in other cases, if there's a small area to treat and it's something that can easily be numbed, this is something that can be done under local anesthesia. Some of that depends on the surgeon preference and depends on the patient preference, but a lot of it depends with how many areas you're going to treat, how much you have to do, and how aggressive we need to be. Well, the recovery depends on how much you do, how many areas you treat, and where they are. Typically, most patients are going to be back to relatively normal activity in under a week. For instance, if you had liposuction of, say, tummy and love handles, you might be driving a car in 3 days, you might be back at work in 5 to 7 days, and back to doing some exercise maybe a week after that. Some patients can go a little faster and some take a little bit longer. We're all individuals.